Evidence-based practice. Evidence-based practice begins with someone desiring to understand the knowledge and skills that are necessary to provide the best possible care for the clients and their families. When trying to establish evidence-based practice, and the nurse will often identify a problem, asking why and how. The first step in evidence-based practice process is asking a clinical question. The clinical question is in a PICOT, P-I-C-O-T format. This is the population, the intervention, the comparison, the outcome, and the time. The population is the clientele that are used, and they are a very specific group of individuals whose focus is the design of the investigation. The population is defined as narrowly as possible. The intervention is the treatment or action the nurse desires to investigate and its effectiveness. Comparison identifies the current practice utilized and the alternative therapy. The outcome addresses the result of an action or an intervention the nurse is questioning. The inclusion of a specified time period is optional. Credible sources of evidence are once the nurse has developed the PICOT question, looking for credible sources of evidence is the second step in the evidence-based practice process. This is conducting a thorough literature search. A literature search involves the collection of information from credible resources, textbooks, research findings, articles that talk about practice recommendations, and credible websites. For evaluating the findings, the nurse will look at each article that was attained in the focus literature research, review the article, and make notations about the article's focus and the findings. The nurse will arrange the information into various categories so it can be compared. When implementing recommendations, the nurse will use evidence to implement practice changes, and this can be the most challenging part of evidence-based practice. Before implementing changes, there are many factors that must be considered. The cost of supplies, the amount of time invested, the monetary investment that is necessary to train staff. And during this change process, some staff will resist the change. For evaluating the effectiveness, the nurse will address the outcome of the PICOT question. Following the implementation of the recommended changes, the information is then collected to determine if the change was effective. Disseminating results of evaluation is the final step of the evidence-based practice model. The information that will be shared will enable members of the organization to make informed decisions about the effectiveness of the practice change and whether or not the practice change should be maintained. Nursing research generates knowledge to enhance nursing practice and stimulate additional nursing research. The nursing process is applied to the research conducted to develop the evidence-based practice. There are 5 steps. The assessment, which is identifying the problem. The analysis, which is formulating the research question or the PICOT question. The planning phase, which is designing the actual research method. The implementation is where there will be a recruitment of the population or the participants, and there will be a collection of data. The evaluation phase is the analysis of the data that is collected and the results that are disseminated or shared. Research is divided into two main categories, qualitative and quantitative. Quantitative research uses numerical data to evaluate outcomes. Quantitative research consists of numbers, counts, or measures that are collected and analyzed using statistics. Qualitative research assists in increasing understanding, describing, exploring, or illuminating value-laden issues in healthcare. The data is collected through narrative stories because the participants discuss or explain their reasons, their attitudes, and their motivations. Qualitative researchers aim to understand what an experience feels like from the perspectives of the individuals that are going through the research process. Nurses first consider the source of evidence. It is vital that nurses seek the most legitimate sources. The information obtained must be reviewed for its credibility before it is included as evidence. When assessing evidence, scholarly databases are an efficient portal that enable nurse researchers to access a wide variety of research articles and academic information through the use of the internet. Examples may be Agency for Healthcare Research and Quality, the Cochrane Database of Systematic Reviews, the Cumulative Index of Nursing and Allied Health Literature, or CINAHL, and Google Scholar. Credible information obtained from websites with names containing the domain of edu, .gov, or .org will provide factual information. An abstract on a research article is a brief summary of that actual article that identifies the purpose of the research study, the basic study design, the research findings, and the research conclusions. Peer-reviewed journals are articles that are reviewed by other professionals that have similar licensure, education, and expertise to ensure quality and to promote client safety. These articles have undergone rigorous review, and the author has made any necessary edits based upon the feedback from the expert peers before it was published. Non-peer-reviewed sources like newspaper articles, popular magazine articles may be written by a journalist that is not a scientific specialist. These articles will provide anecdotal information and social opinions, and they may reference scientific research. Routinely non-peer-reviewed articles do not contain the quantitative or qualitative research data that are foundational to keeping evidence-based practice relevant. Citations and references. These are used for recommendations for evidence-based practice changes. These are the available literature and research on a designated topic. When the nurse compiles the evidence, the nurse will cite or record every source that was used to support the recommended change. The failure to cite or to give credit for work of anyone else is considered as plagiarism. Established resources assist nurses in utilizing evidence-based practice for client care, and these may include clinical practice guidelines, clinical pathways, and standards of care. Clinical practice guidelines are evidence-based recommendations that are used as guidelines in medical management of specific disease processes and preventive care. Clinical pathways are considered as clinical tools that are used in healthcare to manage healthcare delivery. The treatment for delivery is based on the specific disorder or circumstance and then implemented by the interdisciplinary team as they care for a specific client. An example would be a code blue or a rapid response. Critical pathways will enhance teamwork and collaboration, reduce the cost of medical care, and improve client safety and outcomes. These are often viewed as algorithms in a healthcare facility. Standards of care are interventions that are typically implemented when caring for a specific disorder. Standards of care are based on high levels of evidence and reviewed regularly to ensure their currency. Professional specialty organizations assist to develop standards of care to create patient care planning and interventions for specific disorders.